Welcome back, my beautiful friends. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Today in My Healthy Minutes, brought to you by Revere Securities, we are featuring my awesome friend, Amy Kennedy, Education Director of the Kennedy Forum, and she is joined by my good friend, Anthony Hadzimichalis, Doctor of Education and Executive Director at Westbridge Academy. Now, Westbridge Academy is a specialized school in Bloomfield, New Jersey, serving students with emotional, behavioral, and learning challenges in grades K through 12 who are not successful in other school settings. The school is a nonprofit where all students attend at no cost to parents. Now, the mama in me says schools like so are invaluable. Today, we're chatting about the ongoing mental health crisis unfolding in schools across America, and especially right here in New Jersey. Things are hitting close to home. The number of students reporting anxiety or depression has doubled since the COVID-19 pandemic started. It's bigger than the pandemic, quite frankly, and the climate that the country is facing, coupled with the pandemic, has increased the need for mental health services. More than 2 years of isolation and worry on a mass scale are taking their toll on kids in New Jersey and across our nation. As children headed back to class this September for yet another academic year in the virus's shadow, it's actually not clear how much better schools are prepared to deal with what many call a mental health crisis, even with a massive infusion of federal aid. Now, tensions are high and signs of distress are easy to spot, educators say, noticing more and more students keeping to themselves and mixing less with their peers. More children than ever are asking for help from a safety net of counselors and school staff that was already spread too thin pre-pandemic years, say administrators. And here to chat some more are my experts at hand. Welcome to the show, superstars.
Hey, great to be with you.
Great to be with you as well.
Okay, Amy, let's start with you. So the wait list to have a kid evaluated or seen by psychologists in schools is months. A nationwide study of school counseling resources from 2015 to the present concluded that all 50 states are failing students in some way, and children and youth are experiencing soaring rates of anxiety, depression, trauma, loneliness, and suicidality. According to the report, 86,000 of New Jersey's 1.3 million K-12 students have dealt with major depression in recent years, and only 42,000 have received treatment. What do you say to this?
You know, Zen, it's not just a problem in the schools, it's a problem out of the schools. We know that 43 out of 50 states are considered to have a severe shortage of child psychiatrists. So if you can't find that service through your health insurance, through your medical team, it's very difficult to find it in your school. There's a shortage of counselors and a shortage of psychologists, psychiatrists, and we're seeing it in every aspect of where students interact. And so being able to get into that system at school is going to be challenging. We know we need to do things that are prevention-based first so that we can lower the number of people that are putting demand on the system.
It's interesting because New Jersey averages one school psychologist for every 731 students, one school social worker for every 655 students, and one school counselor for every 358 students, Amy. And in a sign of how far the nation lags, the psychologist ratio is actually one of the best in the nation. And New Jersey ranked 7th in the U.S. this year, which is up from 22nd in 2015. And yet, if we're ranked the best, that's definitely not enough hands-on experience to address the ongoing crisis. So these numbers are very perplexing. Anthony, with the coronavirus pandemic contributing to the rising rates of depression and anxiety among kids, Governor Phil Murphy's administration has announced a statewide plan in New Jersey that would make mental wellness a priority in the classroom and identify and refer students in need of counseling services outside their school. And Westbridge Academy is just that. Please explain to me how you on-take and onboard students that come your way.
Well, like you mentioned, the data is staggering. And what we try to do is in line with the plan that you talked about. What we try to do is create a community where we can extend a bridge of conversation. From the second a kid comes off the bus, good morning, how are you? How's it going? How was your day? How was your ride in? right? So we're smiling, we're using our own natural abilities to connect with people the same way that we would do with anybody else. We're doing it at the curb. So things start the second a student arrives at campus. And what we're able to do is build an environment that leads to the interior of the school in which everyone knows each other's names. We all know each other. We're small enough to be able to do that. Knowing each other's names, knowing, for example, patterns. Student comes in day after day after day wearing the same clothes. Something's wrong. Let's figure that out. All right, great. Let's make a referral over to one of our counselors. So we've got that process in motion. So we do that every single day. We make assemblies a regular part of the routine at Westbridge Academy. So I would say probably every couple of weeks, 3 weeks perhaps, there's an assembly to raise awareness. So we could just make the conversation about emotionality just normal, because why should there be a stigma? So those are a couple of things that we do. And then we try to connect our kids who need it most immediately with a person who's qualified and able to do that. And we're fortunate enough to have a team of licensed clinical social workers right here at the school.
And yeah, with a 6-to-1 student ratio, the Westbridge really gives each student personalized instruction. Not every school has that runway, so you're very fortunate in that capacity. Amy, according to a recent CDC report, nearly 1 in 4 young adults in the United States has been treated for mental health issues during the pandemic, and the U.S. Surgeon General issued a report indicating more than 1 in 3 students reported feelings of persistent sadness and hopelessness, depression and anxiety, and even suicide attempts. Those are all on the rise. We're at a crisis point, and we need new tools and new strategies that reflect this new reality. What is your proposal to get the kids the skills and treatment that they need?
Yeah, I think, the doctor just pointed out one easy thing is just that connection. We know that connection is so important. So their devices need to be put down. They've got to connect with one caring adult in their life. It makes such a difference. And it can be someone that's a trained mental health professional, but it doesn't have to be. There's a lot of cases where young people can see a change if they just find that person they can trust and build that relationship. But we also know that some students will require more. And so how do we provide that training for everyone from coaches and educators to the librarians and crossing guards that can do the early intervention and be able to detect those students and detect the signs that show maybe they do need more serious interventions? Once we have that, we can do those screenings, whether it's at the pediatrician's office or in the school office, and direct them to the care through their social workers and psychologists. And that will be very important. We know telemental health is a real great tool in helping to bridge kind of the gaps we're seeing in service.
You're brilliant. I love the way you framed that out so nicely. I wish everybody would take exactly that proposal and apply it. It would really start to mend many of the issues. Anthony, the American Academy of Pediatrics has declared childhood mental health as a national emergency, citing suicide as the second leading cause of death in adolescents aged 10 to 24 since 2018. We have more than 140,000 children in the U.S. That have lost a caregiver as a result of COVID-19. And since 2020, emergency room visits have spiked for adolescents experiencing a mental health crisis. They also point to structural racism, interestingly enough, as disproportionately contributing to depression, anxiety, trauma, loneliness among kids in communities of color. How do you address these ongoing issues at Westbridge, and do you have diversity and inclusion programs?
Definitely. It comes back to the idea of conversation and talking, and we do that in a variety of ways. And one of the things that we do is we have smaller classrooms. So the numbers of students in the room wouldn't really exceed more than 6 or 7. Right. And so we have conversations at the very beginning of the school day, all classrooms from kindergarten all the way up to 12th grade. Conversations start before the academics start. We're talking again, the idea of, how did it go today? How was your walk over here from the other room? Conversations about that. What's on your mind? Stuff like that. Then we get into whatever the lesson may be. And then before the lesson's over, we wrap up again. I can't wait to see you tomorrow. Did you have any questions, general ideas, thoughts that you wanted to share before we move on to the next class? So that's all part of the system. We have students here of all demographics, of all ages, of all religions, of all likeness and kind. And we talk and understand one another. Another thing we do is we focus on music. music is a big part of the program here. We're putting a recording studio, professional grade recording studio in the facility as we speak. We're looking forward to launching that real soon. But we find that music is a common language. People can bond around it. People can raise all kinds of ideas that they might have never raised before, or share thoughts and ask questions that they never did. So we make music listening, and we make music creation, development, and recording a major, major part of the program. Dance as well, and singing, of course, going along with just generally the idea of music. So really pushing the arts into the program and allowing students to see that we have a lot in common. There's a lot in common. So that kind of lowers, levels the playing field a little bit. And we know that the underlying root cause of suicide, and we talk to people who were approaching it, and we understand that it's feelings, right? Feelings of distress, feelings of irritability, feelings of agitation, right? And these are things we all feel. But some of us have the ability to lean over to a friend and say, hey, I need to call you, or let me text you. Others might not. So at our school, we have kids as young as 5, 6, and we're helping them form those social relationships so that they do have a network that they can reach out to here at the school to start, but also at the home front. So we do a lot of home outreach and talking about the things that we're talking about here, because frankly, it matters. It matters to the tune of what we're saying about the data, staggering data.
Yes, and mental health challenges, of course, can affect success at school and in life, but yet few students get the help that they need to thrive. So what you're doing sounds like is very proprietary and very unique, because it's not being done across the country. Amy, over the last 3 decades, we've talked about this before, but anxiety and depression and suicide and self-harm, those have all soared. In 2019, going back to the statistics, the American Academy of Pediatrics issued a report noting that mental health disorders have surpassed physical conditions as the most common issue causing impairment and limitation among adolescents. And that predates the pandemic, though. And so it means that there needs to be a close examination of other possible factors, including, yes, social media. Please give me your thoughts on this.
That's what pediatricians are all saying. They're talking about how many young people are coming into their offices for mental health concerns over physical health concerns, and how interrelated they are, really, as they are with academics, as the doctor just pointed out. For parents who are listening, I would recommend checking out Screen Sanity. It's a nonprofit that's doing some of this work to educate parents on how to help intervene with their kids and devices. And they're doing really important work. I know, we all should be getting a kit when we decide to purchase that first phone or first device for our child that gives us the breakdown. How do we monitor that? Because I know we all feel a little behind the young kids themselves on how to operate these, right? And how do we set up the parameters when they're 2 steps ahead of us? So organizations like Screen Sanity and others that are doing the work of trying to educate parents are really helpful. And we know that this is going to be key to bringing them back, while they can be used to help, find their passion. And that's fantastic. Or to connect with others. There's a lot of time that it pulls them away from making those real connections. And so it's concerning. I think it's concerning for all of us who have teenagers, who have kids, that we see them kind of put their head down, put their earbuds in, and tune everything else out. And we're seeing higher and higher rates of kids in distress every year.
Yeah, it would definitely have to start limiting this stuff. Well, we're out of time, but thank you so much for coming on and giving us your expert advice and opinion. Amy, it's always a pleasure. Anthony, thank you so much for piping in here.
You're welcome. Thank you so much. Good to meet you, Amy.
You too. Take care.
That was our My Healthy Minutes segment, brought to us by Revere Securities. That was Anthony Hadzimichalis, Executive Director at Westbridge Academy. You can head directly to their website at westbridgeacademy.org. And that was Amy Kennedy, Education Director of the Kennedy Forum. Definitely check them out, thekennedyforum.org. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by Revere Securities. Revere is committed to building a relationship of trust in which they work closely with you to help you define your objectives, explore alternatives, and choose the financial and investment strategies that are most appropriate for you. Go to reveresecurities.com.